You should know 10 facts about diabetes and insulin. Nowadays, everybody knows someone living with diabetes, but how much do we know about diabetes and its management? 1. Globally, 1 in 2 people with diabetes is not diagnosed. Many people with type 2 diabetes remain unaware of their condition for a long time. And according to the International Diabetes Federation, 1 in 2 people with diabetes globally is not diagnosed. The reason for this is that the symptoms of type 2 diabetes are usually less marked than in type 1 diabetes and may take years to be recognized. 2. Most type 2 diabetics will eventually require insulin. Type 2 diabetes is a progressive disease, which means the body's ability to produce insulin will decline over time, and most patients will eventually require insulin therapy. 3. Poor blood glucose control can lead to serious complications. To delay diabetes progression and lower the risk of diabetes complications like cardiovascular disease, blindness, kidney failure and nerve damage, diabetics must maintain careful control of their blood sugar levels. Starting insulin therapy might be the most effective way of doing this. 4. Starting on insulin is often delayed by patients and physicians. Starting on insulin is often delayed by patients for several reasons, including denial of the need for insulin, fear of injections, fear of weight gain and hypoglycemia, episodes of low blood sugar, complexities associated with insulin use. Starting insulin is often delayed by physicians for several reasons, including concerns about potential side effects in patients, hypoglycemia, weight gain, perceived adherence issues, difficulties in training patients to administer insulin. 5. Starting on insulin is not a personal failure. Starting on insulin does not reflect a personal failure on the patient's part, but rather a natural progression of the disease. 6. Insulin therapy is not a one-size-fits-all. Your doctor will prescribe a therapy and insulin delivery device that best suits your condition and lifestyle. 7. Insulin devices and needles have come a long way. Great advancements in insulin delivery devices and needles, such as discreet and easy-to-use insulin pens and finer, sharper needles, have reduced the inconvenience and pain associated with injecting oneself. 8. Newer insulins aim to reduce side effects. The goal of new treatments for diabetes is to achieve glucose control with fewer side effects, e.g., reduced risk of hypoglycemia and blood sugar variations. 9. Adherence is key. Although it might sometimes feel like your medication is controlling your life, taking medication as prescribed is important to achieve a beneficial outcome and to lower the risk of long-term complications. 10. There are options in treatment. Newer insulins might offer improved flexibility in dosing with fewer injections, which could improve patient adherence to medication. They may also lower the risk of side effects. Discuss your treatment options with your doctor.